Today, we're going to talk about uh, endometriosis, polycystic ovary syndrome, and fibroids, right? It
Yep.
affects so many women, and I can personally speak to fibroids. I had my own journey with fibroids, and so I definitely am interested, to hear, your perspective as a physical therapist, because at the time I was going through it, I did find a functional medicine provider that helped me, but I didn't really know that physical therapists could help with some of these things. So tell us kind of what's happening in women's bodies with these three conditions. Let's break
Yeah, absolutely. So let's start with PCOS. So as you said, that's polycystic ovarian syndrome. So this is categorized usually if you are somebody that has some infrequent cycles and generally like on the longer end of things. So maybe you are having like 40-day cycles or you're missing cycles. That could potentially be a little bit of a flag that you might have PCOS. And then if you dive deeper, kind of in the traditional medicine world, what they're going to look for is, do you have some elevated male hormones, so like testosterone or androgens? They will hopefully also do an ultrasound on your ovaries and they might find multiple small cysts and they will call it a string of pearls. That's just because they have multiple little um, follicles that are developing at the same time. And then looking at it's often correlated to with some insulin resistance. And so that's kind of the broad category, but generally those infrequent cycles are what's telling us something is awry and we need to dig a little bit deeper.
What are some of the early warning signs, that something more is going on and women should seek, medical assistance?
Yeah, this is actually a really big problem because it's generally anywhere from 8 to 10 to 20 years for some folks to get a proper diagnosis with a lot of these things that are going on. Um, and the reason why, well, I think there's several reasons. Most people, number one, don't really know what a normal cycle should look like. Um, and then we could go a step further. Most people aren't actually paying attention to their cycle
Mhm.
at all, really. And they might notice a couple of symptoms, but they're just not really aware of what's happening in their system and in their body. And then if you are and you're going to a doctor and you're giving them these symptoms, a lot of doctors don't necessarily know what to do outside of maybe putting you on birth control. And that's kind of the end point to a lot of these things. And while, like, yes, that might be okay from a symptom management perspective, it it shouldn't stop there. The treatment shouldn't stop there. That should potentially be your starting point. And then even like to step back, like identifying like what is a normal period versus not. Because I think so
Yeah.
many, if you have had kids and maybe you had heavy or painful periods and you don't even realize it, and we're just kind of like passing that like, oh, that's just normal on to our kids. Um, so I'll quickly kind of reframe what a normal cycle should look like.
Yes.
Ideally, we want a cycle 28 to 31 days in length. So that means 28 to 31 days between when we are bleeding or menstruating. Okay, so cycle day one is the first day we start bleeding. Number of days that we should be bleeding is around 4 to 5. Okay,
Hmm.
so less is not better,
Hmm.
longer is not better either. And then we need to look at how much we are bleeding. So the average blood loss should really only be 40 to 60 milliliters for that entire menstruation period. So
Hmm.
if you're using tampons, a fully saturated super tampon holds about 10 milliliters. Most menstrual cups are like 40 to 60. A um, a regular pad would be about 10 milliliters. So you have to do a little bit of math because most people are changing
Sure.
before it's fully saturated. But like if you're somebody and you're going through, you're fully saturating like a super tampon every 2 hours, or you have to have a
Yeah.
pad underneath, like you are already, that's not normal. And
Right.
so that is something that you need to talk to a practitioner that understands this about, because I do think like what I have found in my experience is so many people thought like, oh, my period's not heavy, and then I have this conversation with them and they're like, oh, but it is. We've come to
Yeah.
find out. And also the reverse is true. Too light of a period isn't good either. So if you're, it could be 4 days, but it's really, really light, and you're like, oh, I just need a panty liner. I would never
Mhm.
saturate a full pad. Or maybe it's only 2 days and still pretty light. So that's not normal and not good either. And then we get to
Right.
pain. So I feel like we've normalized too, like, oh, like take some Advil, take some Aleve, take, what is that one for period pain? There's
Midol.
like a specific, yeah,
Midol.
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 Um, use the heating pad. Like if we're having to like take some things or do all of
Yes.
these extra things to help us function when we're on our period, like we shouldn't be having that much pain. Maybe a little bit of minimal cramping, but it should never be to the point where we think that we need to take a medication or it's stopping us from like participating in any aspect of our life. So the first step for me is to actually get that connection with their body and start to really listen to what you're feeling and what is going on. Because if we are so disconnected from how we feel and or we've ignored it for so long, um, we can't really move forward. So kind of just taking, so if that means for you, like, taking a month and kind of tracking your energy, tracking your sleep, tracking your stress level, tracking your cycle, um, and not doing it from a place of like negativity, but just like being open to like, I'm curious, like, am I waking up in the morning? Do I feel rested? Do I feel like my energy is good and stable throughout the day, or do I feel like there's lulls? Is it always, after I eat a meal or always at 4 p.m.? Or what does that look like? Am I falling asleep easy at night? Am I waking up at night? What is my stress level with home and with work or with whatever that looks like for you? And I think just keeping an eye on those things and really getting that, like, where am I right now, can be so eye-opening for people. And then those
Mm.
are really things that we want to look at. And I'll add in like digestion too. So, like bloating and things like that. So, if you're tracking those things, as we start to do some interventions, those are also the symptoms I want people to track to tell us we're moving in the right direction. Because ultimately, you should be sleeping, 8 to 9 hours. You should fall asleep easy. You should be sleeping all night. You should be waking rested. Your energy should be like stable throughout the day. Like you shouldn't be having all these ups and downs. And you should, stress definitely can go up and down, but you should feel like you can manage it well. And then from that, our cycles should be pretty regular, like if our body and everything is functioning as it should.